Hello and welcome to episode number 6 of the Pocket CI podcast. I'm your host, John Schaefer. And today we're going to be talking about all things certifications. These are certifications that get while you're a PT student, after you graduate, and just talking about the pros and cons of certifications. I think a lot of clinicians, a lot of students will chase letters at some point in their career. I'll be the first to admit it. I got my OCS, I got my CSCS. For a while, I thought maybe that's not enough. Maybe I need more certifications, but I think that looking back, I've got a lot better perspective on the benefit of certifications, what they are, what they aren't, and a lot of sound advice I can give to anyone thinking, okay, maybe I need to get a certification or maybe I need to do this or that. So we'll talk about what different options there are, what they can do for your career, and whether or not they might be right for you or not. Because at the end of the day, you have to decide, like, are you doing this for yourself? Are you doing this for your patients? Are you doing this for your employer? What are you trying to get out of this certification versus I just want to add some letters. You've already got enough with the DPT. I promise you that. Everything that you want to be able to do for the most part, you can do with the DPT. So we'll start by talking about certifications you can get as a PT student. So while you're still taking classes, the two certifications I would look at, the first is a CPT or Certified Personal Training certification. Um, Pretty quick to study for and take, as far as I know. I did not take this myself, but this will open the door for you to do different things like personal training. Whether that's in school, like in your school's facility, or you could also do this in a gym taking on clients and things like that. That can be a great way to practice exercise prescription, can be a great way to earn a little money on the side. And you can build up your own business too if you want to, start to cycle through clients or start to pick up clients. And then once you become a physical therapist, you can continue to treat those clients you're working with in a greater capacity, which I think would be pretty cool and something I may have considered doing if I would go back to PT school now. The second is the CSCS, which is a Certified Strength and Conditioning Specialist certification through the NSCA. This is the certification that I took. It's considered the gold standard for strength and conditioning. Like a lot of people, not a lot, but good amount of people will get this certification after they graduate. And this would be people who studied things like exercise science or adjacent majors, and then they'll graduate, they'll get their CSCS, and then they'll work as a strength coach, work in a gym or something like that. So it's a whole path where you can actually practice as, I guess, movement professional, strength conditioning coach, whatever you want to call that sector. Um, but this would be a good option as well, especially if you want to work in a clinical that's maybe more sports specific, or if you want to, train high school athletes, college athletes. Typically, in most cases, the CSCS is going to open a few more doors. If you're interested in working with sports, a lot of teams are looking for either PTs who are athletic trainers or PTs who have their CSCS. It just shows them that you went one step above and beyond to designate yourself as someone who understands or knows this knowledge. And there's two portions to the CSCS exam. I know a lot more about this in the CPT, like I said, but there's two portions to the CSCS exam. The first is exercise science, which most of you are probably majoring in, so it's really that part's not too difficult. And then there's a practical applied section. This section I struggled with quite a bit. This goes over like exercise technique, programming, training cycles. Doesn't necessarily sound crazy on paper when you hear that, but I think the problem with this is in PT school, you learn so much information that there's so many opportunities to overthink. I'm a big overthinker to begin with. And so when I came to this exam, like it seemed like things should be pretty straightforward, but I found myself doing a lot of overthinking, and I think I talked myself out of a lot of correct answers. So I ended up not passing the CSS exam 2 times. I took it, I think, 3 times total, but I failed the practical applied section 2 times in a row, and I didn't even know if I was going to take it the third time. So I was like, maybe I'm done. I'm done with this. Like, I don't need this. Why am I putting myself through this? But it did open some doors down the line. I was able to do a strength conditioning internship at Champion PT and Performance in Boston, Massachusetts, which was really cool. And I can't say I use it a ton day to day in my current role doing home health, but there's been times in my past where I've been working with endurance athletes, runners, cyclists, and I've used, some of the training cycle principles there. The exercise technique stuff was a great while I was in clinicals. I did this I think between my second and third year of PT school. And I will say that, if you're struggling with exercise prescription or struggling just with exercise ideas, that's something that I think a lot of students, I've had a lot of conversations with a lot of students who are like, I feel like we're getting a lot of this information, but it's not clicking. Or we're having TheraX labs that are, 3, 4 hours long. I feel like I'm learning these exercises, but I'm not necessarily putting everything all together. And that's where I think the CSCS can be a huge benefit in supplementing what you're learning in PT school because it does give you like some of those, um, it just gives you different frameworks that you can use when it comes to strength conditioning, when it comes to programming, because at the end of the day, a lot of that typically falls on your clinical instructors on rotations, like whatever your CIs are practicing in their clinic, that's typically, you'll mirror them and how they practice, which I think can be good or potentially dangerous. And then also, well, not dangerous, like you're going to put the patient in harm, but dangerous in that you're not exactly forming your own thoughts all the time. You're kind of mirroring what you see. And there's also like a lot of times people nowadays are getting a lot of their exercise ideas from social media, which I don't think is inherently wrong. Um, but this just like if you don't want to take the CSCS exam, if you don't want to sit for another exam, fine. But I would still say consider looking at the Essentials in Strength Conditioning textbook. You can always look at the PDF online. I know it's out there in quite a few places. Didn't hear it from me, but it's out there. Um, that you can start to look into. So I would recommend that. And then if you are going to take the CSCS exam, look into the Movement System by Matt Castro. I think it's maybe $100 or $200, but it's very comprehensive. And that's what really helped me pass when I finally did pass. And if you don't want to pay for the course or things like that, he's got tons of YouTube videos that go over um, various pieces from the CSCS textbook. So again, those are just two options to get as a PT student, but it's not something where you absolutely need these. It may open some doors when it comes to different opportunities, especially if you're interested in, orthopedic, strength conditioning, working with high school, college, potentially pro athletes, could give you a little bit of an edge. What I mean by that is like if there's clinical rotations you have to apply to, if you and a classmate are both applying for them, you have your CSCS, they don't, it might give you a little bit of a boost. But it's not going to make or break your career as a PT. I promise you that. There's a lot of PTs who don't have their CSCS that have a much greater understanding of some of these principles than someone who sat, for a 4 or 5 hour exam and passed. So that's while you're in PT school. After PT school, everyone's thinking about, should I get board certified? Should I do a residency program? Is it going to give me a pay raise? Is it going to give me additional opportunities? Is it going to show my colleagues that, I know my stuff? The important thing, take a big sigh there because I think that a lot of these thoughts are misguided. A lot of students coming out of PT school think that, maybe they're not ready or they don't feel 100% confident and that they need to get additional training, additional certifications. And I fell into that trap too. But what I want you to hear right now is after you graduate PT school, after you pass your board exam, you're licensed to practice, you're safe to practice. The Board of Physical Therapy has deemed that you know your stuff. You know enough to practice where you're not going to hurt patients. You're going to help a lot of people with the knowledge that you have. So it's not something where you need to run and, get a bunch of additional training if that's not what you want to do. I think a lot of people will rush into that training as well. So there's two different paths that you can get a board certification. The first is through a residency program. These are typically 10 to 15 months, we'll say on average, I think around 13. But this would be you're going through an entire year where you're studying the information, ideally closely with mentors. So the residency program I did is like 25 hours of patient care, 5 hours of classroom, 5 hours of teaching. Um, and then we had like other components as well. So we're practicing hands-on skills, we're practicing manual, we're going over the treatment-based classifications, we're going through everything. And over the course of the year, you're basically studying for the exam, but it's in a little bit of a more structured way in the clinic environment. Now, I'm sure we'll do an episode at some point about residencies as a whole, but the short of it is by the end of that year, you're able to sit for the board certification exam, Whereas if you don't do a residency program, then you're going to have to accumulate a certain number of hours in that specific discipline. Most of the time, I believe it takes 2 years, and then you can sit and take it. So you're only waiting a year. You're only waiting a year extra if you don't do a residency, and if you don't know if you want to get certified, um, if you don't know if you what you want to get certified in, then you shouldn't rush into it. Because I think that another important thing to note is you should know like why you're getting a board certification, what it's going to do for you, what doors it's going to open. Um, because I think that a lot of students don't necessarily know like how a board certification is going to translate um, into practice. Because to be completely honest, your patients probably don't know the difference between they don't know what the letters behind your name mean. They might not even know what DPT means in some cases. But I know for me, I had this idea that I was all of a sudden going to be get a lot more respect. It was going to be a situation where my pay might increase a little bit, but that certainly was not true. I didn't even get reimbursed for the exam from my employer. So I didn't get reimbursed for my exam. I did not get a pay raise, nothing. So ultimately, at the end of the day, taking and passing the OCS, as hard as it is for me to say out loud right now, was simply showing myself that I know this information, that I'm a, competent provider, and maybe get a little bit of recognition from some of my colleagues, and that, have spent a significant amount of time with this information to the point where, I know it very well to where I could pass I don't even remember how long it was, if it was 7 or 8 hours, maybe it's six, somewhere between 6 and 8 hour exam. Um, but yeah, it's kind of a hard pill to swallow that, I'm spending all that time and all that effort not to see any direct direct benefit. Um, so that's something to consider as well. And then I guess one thing I'll say when it comes to certifications, this is probably one of the last things I'll say here, but it's so important that you know before you're going to invest a lot of time, a lot of energy, what the outcome of this certification is, what's it going to do for you, what's it going to do for your patients, what doors is it going to open. So, for instance, if you know there's a certain role you want to apply to, or a certain team you want to work with, or a certain situation you want to be in, and it says you need XYZ certifications or to be eligible to apply or work in that setting, then absolutely go after that certification. If you know that your employer is going to reimburse for the exam and you want to take it, fine, great. If you know that you're going to get a pay raise, great, go for it. Um, if you don't feel 100% confident in your ability to treat different conditions, you just want, more information in a certain area, then you can kind of figure out if you want to look at practice guidelines on your own, or if you want to, do a total deep dive for a year and study all this stuff a little bit more in depth. Fine, but know what your motives are, know why you want to do these things, and then, go from there. But I will also say, you can make your own path within the field of physical therapy when it comes to studying after graduation. So you're no longer being forced to learn certain things, take certain classes. It's all on you. So whatever interests you, whatever you care about, spend time studying those things. It doesn't make sense if your interests are, working with dancers or working with chronic pain, that all of a sudden that you would go and get a certification in, I don't know, let's like pediatrics, women's health, neurology. None of those things are applying to what you're interested in. So rather than spending so much time going into the textbooks, studying those things, spend time focused on what you care about, because ultimately that's what's going to be most enjoyable. That's what's going to bring you the most fulfillment in your career, and that's what's going to open more doors and more opportunities. Um, like for me personally, maybe I spend a little bit more time studying different sports, like different, like cycling. Maybe I learned a little bit more about running. Maybe I learned a little bit more about if I could have shifted some of my time there instead of spending so much time. Granted, my residency was in orthopedics, so a lot of that carries over, but just spending more time on the types of patients that you're interested in, the conditions you're interested in, like do that before anything else, and do not rush into thinking, I need more letters behind my name, because again, you do not, I promise you, you do not. It's not going to make that big of a difference in most cases, whatever letters you have. I'm just looking down at my Zoom thing right now, and I don't know why it's listed this way, but it says Dr. John Schaefer, PT, DPT, OCS, CS, CS. And that's a lot of letters. That's a lot of time. That's a lot of effort. Um, but at the end of the day, like most of the time, I'll have just my patients call me John. Well, I worked in private practice. I'll have my patients call me Dr. Schaefer. But that's if you're, being a point of primary care for your patients. So I'm just going to leave it there. Again, if you have questions about specific certifications or if things or if a certain path makes sense for you or doesn't make sense for you, just ask me. We can talk about it. You can ask your professors, but make sure no matter what you do in your career as a physical therapist that you've got a sound reason for doing so. So you can always reach out to me on Instagram. My handle is at the Pocket CI. Got all my videos on TikTok at the Pocket CI. And if you feel like you want a little bit more guidance as you're going through clinic rotations as a PT student, doesn't matter if you're first year getting ready for them, second year, you're in the middle of them, third year, maybe you're finishing up. If you want a little bit more guidance and improving your confidence in the clinic and also getting ready for graduation, what sorts of opportunities exist afterwards, I've got a ton of resources in my bio. I've got the Clinical Confidence Kit, which was where I would start, and you can download that, and I'll give you 5 frameworks to increase your confidence in clinic this week. And then if you need more help with your patient communication, if you're just looking to increase your ability to describe conditions simply to patients, answer common questions, I've got my scripts and eval flows that you can also get access to. And those also have my rundown of how I approach different conditions. So the upper extremity, lower extremity, and then post-operative cases, exam flows, you can go through with all those. And then finally, the Pocket CI playbook, that's got everything. So it's got the scripts, it's got the flows, it's got the clinical confidence frameworks, and it's got so much more that'll help guide you on your rotations regardless of who your CI is. I'm giving you all the information you're expected to know in clinic, but you're not necessarily taught in the classroom. So check out those resources. Let me know if you have any other questions. I'm always happy to help. And feel free to reach out if you need me. We'll see you in the next one.